Was Brad Blakeman, former deputy assistant to President George W. Bush. What's your reaction to what you heard just now?
Well, my reaction is very positive. I think now the House bill, it becomes a good start for Senate negotiation. They're certainly going to do their own bill. But there's nothing, I think, alarming in this other than the fact that Obamacare, as we know, is broken and must be fixed. And it's on the Republicans' watch to fix it.
Yeah. I mean, that number, so we're trying to sort through all the numbers and see what's going to jump out. I feel like no matter what, there's going to be something in there that Democrats will seize on to make this argument. You know, there's going to be people laying down on the ground and dying in the streets as a result of this plan.
But let's remember, the CBO was off by 14 million people under Obamacare. They're not very good at predicting the future and the behavior of people as to what they're going to do with their own money. But we do know this, that we need to come up with a plan that covers people affordably and that gives people choice. This is currently not the option under Obamacare. Now, Republicans ran collectively, not just the president, on repealing and replacing Obamacare. The burden is on them, and they only have this year to do it. Once we move into 2018, it's going to be all about every man and woman for themselves for elections. So if I were the Republicans in the Senate, I would say, this is good fodder, this is good ammunition, but you have to come up with your own bill that can be reconciled.
So the challenge becomes, so for people out there, they're not stupid, and they knew last time around that their health care has gotten more expensive, their deductible has gone up higher, that it hasn't worked out for the better. At the same time, they're afraid of this idea, you're going to lose everything. So it seems like Republicans have to make the insurance situation feel materially better to people at home within the next year, in order to have sort of fulfilled their promise. That's going to be hard.
It is going to be hard because when you reach the fall, they're going to be getting their notices again, and that's going to be under the old system. So we have to have a plan of transition, and we have to have a plan of implementation. And the longer we seek to solve this, the longer the transition will be and the longer the wait will be for the new system to kick in. Right now, it's probably going to be around 2020 before we eliminate Obamacare in its entirety.
They're going to have to find a way for people to feel some sort of immediate relief, because unfortunately, that's the society we live in, is sort of that immediate gratification. Brad, we'll see. Thank you.